My question is also to the Minister of Health. Speaker, I still hear from constituents who have no idea whether or not they're eligible yet for their vaccines, seniors who cannot properly navigate the complicated booking systems, and folks having to wait for hours on the phone to register. I hear from families who are beyond concerned that they're I'm talking about families across this province. I think the minister should listen. The Minister of Energy should really listen. It's really heartbreaking that we cannot get across the stories of our constituents in this House.
I apologize to the member who has the floor. I can't hear the member who has the floor. And I invite her to place her question.
Thank you, Speaker. Speaker, I hear from families who are beyond concerned that their homebound loved ones or those who have mobility issues cannot access vaccines. In fact, last week I heard from a constituent, Alice Walker, whose mom, a senior, had to wait outside in the cold for over an hour to get vaccinated despite having an appointment. Mr. Speaker, it is clear that this government's vaccine rollout is disorganized and ignores equity needs in communities like mine in Scarborough and many other parts of the province. The budget announced yesterday was a disappointment for Scarborough. It ignored the needs of Scarborough healthcare needs, for example. Why wasn't Scarborough mentioned in the healthcare budget at all? Our infrastructures, our buildings are the oldest in the province, Mr. Speaker, and yet this vaccine rollout is another disappointment. Can this government commit to a truly equitable vaccine strategy that is not one-size-fits-all and takes into account the unique and necessary needs of our communities like Scarborough and Northwest Toronto? Thank you, Speaker.
Thank you. Minister of Health.
Speaker, there's a lot there, and I'll try and answer in the short time that I have available. But first of all, I would say that no part of Ontario has been forgotten. With our budget, including Scarborough, all hospitals across the province of Ontario have received a 3.4% increase, which has been recognized and acknowledged by Anthony Dale, the head of the Ontario Hospital Association. He welcomes this investment, which will allow hospitals to respond to COVID patients, other patients, and vaccine rollouts. With respect to the vaccine rollouts, our system, our booking system, is robust. It has withstood hundreds of thousands of calls. As of yesterday, we had 551,000, over 700 appointments already booked on the system. If people are having problems accessing through the booking system, they are certainly welcome to call our on-call centre that they can receive assistance there for booking. But as for people not being able to receive bookings if they're inbound or homebound, that is absolutely not the case. We are going to make sure that everyone in Ontario that wants to receive a vaccine will receive a vaccine, whether that's through the assistance of their primary care provider or through their home and community visiting nurse. Everyone who wants one will get one, and our booking system and our customer care system will help them to be able to do that.